name is Megan Traylor, Communications and Development Assistant at the National Fund for Workforce Solutions. I will be covering a few housekeeping details before introducing our speakers. If you experience technical difficulty at any time during this WebEx webinar, please submit your technical issue in the Q&A panel, and someone from technical support will assist you. All attendees will be listed in only mode throughout the duration of today's call, and as a reminder, this call is being recorded. After the webinar, the recording session will be sent out via follow-up email once available and subsequently uploaded to the National Fund website. We'll be doing a Q&A session toward the end of today's presentation based on the questions that have been submitted by the audience. You may ask a question at any time throughout the event by entering it into the Q&A panel located on the lower right side of your screen. I would like now to introduce the facilitator of today's webinar, my colleague Kelly Aiken, Director of Career Stat, an initiative of the National Fund for Workforce Solutions.
Thank you, Megan, and welcome everyone. Good afternoon. This is the second webinar in our 2017 Career Stat webinar series. Today, October 11th, I am thrilled to start off with a program called Partnerships and Pathways, Strategies for Advancing Your Frontline Workers. Next slide, please. So today's webinar features Beth Israel Deaconess Medical Center and Hebrew SeniorLife, both organizations that are based in the Boston area. And today we have Joanne Pukowski and Marianne McDougall, who are here to tell us what their organizations are doing and the success that they've had in developing strategies to advance their incumbent workers. Joanne Pukowski is Director of Workforce Development at Beth Israel Deaconess Medical Center and also the Chair of the Career Stat Executive Committee. Mary McDougall is the Director of Professional Practice and Education at Hebrew SeniorLife. I'd like to thank you both for taking time out of your busy schedules to be with us today. And I'd also like to acknowledge that both of your organizations have been recognized as frontline healthcare worker champion organizations by Career Stat and the National Fund. This designation is for your sustained commitment to investing in your frontline workers. And this webinar series is really intended to highlight the great work that is going on across the country by our champion and emerging champion organizations. Collectively, they demonstrate that through scope, scale, leadership, and infrastructure, that they know what it takes to really invest in their frontline workforce and grow their own staff, such that they have great opportunities to advance towards family-sustaining jobs and opportunities. Next slide, please. Now, before Joanne and Mary tell you their story, I'd like to just give you a little background about Career Stat. Career Stat is an employer-led network of healthcare leaders promoting increased employer investment in frontline worker skill development and career advancement. For the last 5 years, healthcare leaders from across the continuum of care have advocated for employers to create and sustain workforce development programs that both foster skill development and career advancement for their workers, but at the same time give the organizations both positive impact and the ability to deliver high-quality, patient-centered care. For Career Stat, frontline healthcare workers are defined as those who provide routine and essential services in all settings, including hospitals, outpatient care, behavioral health, long-term care, and home health care. And today you have a great opportunity to hear what's happening in 2 different types of care settings. Collectively, frontline workers are responsible for a range of operations, including providing administrative, direct care, environmental, and technical services to patients, families, and caregivers. Ultimately, we believe that frontline workers form an organization's backbone needed to deliver high-quality care and ensure an excellent patient experience. Next slide, please. Career Stat is free to join and open to all who have an interest in healthcare workforce development, including employers, healthcare workforce partnerships, workforce intermediaries, education and training partners, CBOs, and philanthropic partners. Joining the network is as simple as filling out an online form located on the National Fund website. As a network, Career Stat is dedicated to sharing information and fostering peer learning. Our offerings include strategies to make the case for increased investment, peer learning, such as convenings and site visits, employer recognition, as I mentioned, through our Frontline Recognition Program, technical assistance, including our new Employer Academy that's going to kick off next month, case studies and best practices, particularly those that are captured in our Guide to Investing in Frontline Healthcare Workers, and last but not least, national leadership opportunities for individuals who want to get engaged at the national level. Next slide, please. So at this point, we'd like to take a few minutes to get a better understanding who is on the line with us. We have two interactive polls that will follow one right after the other, and we'd like to invite you to participate in them. First, please tell us a little bit more about the organization you represent. You should see on the right-hand side of your screen the first question. So take a minute to tell us if A, you're a healthcare employer, B, you're a training and education provider, C, you're an intermediary, or D, you're a philanthropic partner. Now, I recognize we don't have an opportunity to give endless numbers of categories, but if you fall into one of those four, please take a moment right now to fill that out. Okay. And so now we should be seeing we're going to close the first poll, and we'd like to take a moment to see what our results are. And I'd just like to ask our moderator if we should be seeing our results.
5 more seconds.
Thank you. Okay, great. So we have about, great breakdown, 40% are healthcare employers, and close to another 40% are intermediaries. So thank you for taking that poll. I see some of you also jumped in and took our second polling question. So I don't think that we can actually go back to that, but that is, we wanted to know how many of you are actually engaged in incumbent worker training programs. And it looks like about 30% of you are currently running incumbent worker program. Close to 15% of you are considering it or just getting it off the ground. We have 20% of you who are actively considering starting an incumbent worker training program. And then, fortunately, the minority of us, 9%, are not considering one at this time. We hope perhaps maybe after the end of this webinar you might be considering this. So thank you for taking the time to tell us a little bit about who's on the line with us. This will give our speakers, Joanne and Mary, a little bit more information. So at this point, I'd like to turn it over to Joanne Pukowski from Beth Israel Deaconess. Joanne?
Hi. Good afternoon, everybody, and let's just go right to the next slide. Let me tell you a little bit about Beth Israel Deaconess Medical Center. We're a Boston teaching hospital affiliated with Harvard Medical School. We've got 11,000 employees. We're one of 14 teaching hospitals in the Boston area. And just to give you a feel for the competitiveness of this market and how important healthcare is to this market, 1 in every 5 jobs in Boston is in healthcare, and 15% of all jobs in Boston are in hospitals. So hospitals are a very significant employer in the Boston area, which means there's a lot of competition for talent. Next slide, please. So I was brought in 2004 to start a workforce development program here. And some of the challenges we were having were we had a lot of jobs kind of in that middle skill bucket that were very hard to fill. So central processing technicians, we were looking for people who'd completed a program, and there just weren't enough people graduating from the programs in the local area. Patient care technicians, we are looking for people with some acute care skills, but the credential closest to being a patient care technician is CNAs, and those are trained in skilled nursing facilities. So there's a skill bridge to gap there. And then skill gap to bridge there, that's what I meant to say. And another example is research administrators, which are folks who oversee grant funding for our researchers. And we were having a poaching problem where everybody knew everybody else and people were jumping all around. Next slide, please. So some problems we were facing were significant shortages in allied health professions, very specific education and credentialing requirements that were limiting the pool of our candidates. Most people in the general public did not know about any of those jobs. And so people weren't, 5 years old saying, I want to be a research administrator one day. We really needed to educate the general public about a lot of these jobs. And we had a lack of diversity among our credentialed candidates. But at the same time, we had 11,000 employees who were diverse, understood the career opportunities, and were looking for some opportunities to move up but felt stuck. And a lot of training programs at the time were full-time, meant for people who weren't working and far away, and they had limited slots available. So we had to think about how can we think a little bit differently and connect our employees to these opportunities. Next slide. So our solution was what we call pipeline programs. So what we do is we focus on occupations where we're having trouble filling the jobs through normal methods, and we competitively select employees to be trained. We look at their academic readiness, their current job performance, and their skill set. And then we offer training part-time so that employees can keep working full-time and support themselves while they train to this next job. On-site at the hospital after work hours were appropriate, at no cost for employees, and offering the clinical training on-site so they're trained in our way and connecting to the people who are going to be working side by side with them when they get hired. And at the end of these training programs, people who've successfully completed the programs are guaranteed a job. Next slide. So over the years, we've developed pipeline programs in 11 different occupations, from clinical documentation specialists, which are RNs that are trained to look at the medical record and give some feedback on the floors about how people could be documenting their work better to ensure that we're getting properly paid, to nurses, to medical coders, to registration specialists, and pharmacy techs. So all different levels of pipeline program. And I just want to point out, you'll see some squares that have purple edges around them. Those purple edges mean that we worked with a partner, an educational partner, to do this program. And the ones that don't have the purple edges, we've been able to run in-house. So we vary our method depending on what the needs are and what the specific training requirements are for each profession. Next slide. And I just want to give you an example of what our process looks like. So we tend to market the opportunity to our employees, do a lot of Q&A, and make sure people understand what the opportunity is. Then we do a selection. So we look at people's academic readiness, what is the reading, math, English scores that are necessarily to be proficient in this job, getting a sense of how are they doing in their current job. Are they stars who are ready to advance, or are they struggling in their current job and maybe need to get some stuff straightened out before they move to a new job? So this is an example of our patient care technician program when we offered it in-house. We offered classes 2 nights a week for 6 weeks, and the classes were taught by a nurse paid by the hospital, and then our folks left their jobs and were paid as PCT aides working on the nursing payroll, and they did a hands-on training. And if they weren't successful in that, they were able to go back to their old job. But if they were successful, they moved immediately into a job. Next slide. So why do we do this? Why do we run these pipeline programs? We've been able to make a number of impacts. One is we've been able to reduce vacancies. So some examples of that are, for research administrators, we had vacancies of 15% in that job, and we were growing the staff from 31 people to 45 people, and over time we've gotten that vacancy rate down to 2%. And we've graduated 34 people into that role over 8 cohorts of training. So now they look to us as a way to find new talent internally. We also want to increase the retention of new hires. Patient care technicians was a job that turned over consistently, but we found with our first 2 cohorts of internal employees that we had 94% of graduates who got hired still working as PCTs at 1 year and 83% continuing to work at the hospital at year 2. We wanted to proactively fill roles, and when we were implementing ICD-10, we expected a decrease in productivity about 50% among our coders. And so we were able to use a pipeline to bring in 6 new coders to keep that workforce productive and at the level it should be in a tough time where everybody was looking for medical coders. And we also want to become an employer of choice. So when we advertise externally, people know that we have a lot of career opportunities here, and they think of us as a place to come in and then grow your career. Next slide. So we had this idealized version at the beginning of what a pipeline would look like, and we thought, okay, everyone will get on the career escalator, and they'll get off at, one floor, spend some time there, get back on, go up to the next level. What this diagram does not show is the people who weren't able to get on the escalator in the first place because their skills weren't quite at the level where they needed to be to take advantage of any of our opportunities. And it also doesn't show the people who fell off the escalator because they really weren't ready to do a rigorous program, or they didn't really understand the time commitment involved. So we thought about it, and we thought if we want to do this at a larger scale, we really need to have a pre-program to get people more ready to take advantage of these opportunities. Next slide. So we got a grant from the Boston Foundation back in 2007, and the grant was for $500,000 over 3 years to provide a set of services with the understanding that BIDMC would pay for it over the following years 4, 5, and 6. So using that grant money initially, and now we have it totally self-funded, we devised a program called the Employee Career Initiative, and what that initiative offers is pre-college courses in reading, math, and English, and college-level courses in biology, anatomy and physiology, and chemistry, all on site for our employees after work for free. And so we find if people can master these core competencies, it can help them access one of our pipeline programs or just take advantage of other opportunities that are out there. Next slide. So our courses are taught by Bunker Hill Community College faculty, and they're for credit. We pay for the textbooks. We pay for everything at the hospital. As part of this Employee Career Initiative, we also offer career and academic counseling. We do the on-site AccuPlacer academic assessment here at the medical center, so it's very convenient for employees. And we also have employees who volunteered to be tutors to other employees. And just to give you a sense of the scale of this program, we have 85 employees enrolled in a class this fall. We're offering 4 classes, a reading, a math, an English, and anatomy and physiology. We had 11 employees who worked with tutors last semester. We had 707 employees who received some sort of service from the ECI in the last fiscal year, and about 1,300 employees have joined the ECI since its start. I want to tell you the story of one employee named David who came to our career counselor one day and said, my mom says I need to think more about what I'm doing and move up. And David was working in environmental services, and he had for years. And so he worked with our counselor to make a plan. He took some of our courses. He ultimately went to Cambridge College and got a certificate in medical interpreting and is now a medical interpreter. So this kind of success story is just a classic success story for this program. Next slide. I just want to talk to you about a few other services that we offer. We offer English for speakers of other languages, and we send about 15 employees per year to that program. We're lucky in that we partner with some other hospitals that are very nearby. So Brigham and Women's and Children's Hospital and Beth Israel, we all send our employees to the same program run by JVS. So we're able to offer more classes because we've combined all of our employees together and offer different levels of instruction. We offer computer skills classes in basic Microsoft Word and Excel. We offer career development workshops monthly, things like choosing a career path, resume writing, and informational interviewing. And we offer citizenship classes for people who are looking to take the citizenship test and kind of go through that whole process. Next slide. So this is the title of this whole presentation is Pathways and Partnerships. So I'm going to talk a little bit about our partnerships now. One partnership is with Bunker Hill Community College, which works with us in a number of different ways. Sorry. So as I mentioned, they offer our ECI classes. They offer their courses on-site for us, and they offer college credit for people who take classes with us, and they let us be a testing site. They've also partnered with us to deliver training in a number of different ways. We've had a cohort program. All right, I'm going to take a drink of water. We've had a cohort program where our surgical technology and nursing classes happen on site, and we sent everybody through that class. We've also developed a med lab tech program with them from scratch, and we've sent our employees to their central processing classes on campus because we had a small number of people. And then JVS Boston runs our ESOL classes, runs our citizenship classes, and has paid for them through a grant that they received. And they also ran our computer skills classes initially, and then and they funded them through a grant. And then after that grant ended, we brought it in-house. So I'm going to go to the next slide. And I'm happy to answer any questions you have, either now or later. Kelly?
Hi, we're going to let Joanne step aside, and we're going to move on. Joanne will come back to you with some questions. You can take a couple drinks of water. So Mary, let's now turn to Hebrew Senior Life. If we go to the next slide, please. And I'd like Mary McDougall to talk a little bit about the programs that are going on at Hebrew Senior Life, where I think you'll see there's some similarities but some distinct differences, and she's going to talk specifically about what's happening with, or the opportunities that they have for their direct care workers. Mary?
Sure. Hi, Kelly. Thank you. Good afternoon, everyone. Next slide, please. All right, so I'll tell you a little bit about Hebrew Senior Life. We are an organization that offers chronic care hospital services as well as rehab services, in addition to a variety of levels of housing, and also hospice and home care and outpatient services. So we have a lot of diverse services. And as you can see from this slide, we do have a mission and a philosophy to honor our elders with respect and promote their independence and so on and so forth. And as a part of our mission, we do accept special responsibility for the frailest and the neediest members of our community. Next slide, please. And we do have a set of cultural beliefs here at Hebrew Senior Life, and you can see them listed on the slide. Lead the way, go beyond, succeed together, ask what matters, speak up and grow professionally. And these beliefs are really promoted and supported throughout the organization as a way of doing business, if you will. Next slide, please. We do believe in person-centered care or person-directed care and supporting the frontline caregivers. And we do understand about opportunity to help people expand their professional education, deepen their skill sets, and so on. And we try to do this consistently with a goal of the highest possible care for seniors. And every year, the Department of Professional Development, along with other areas of our organization, we reach about 2,600 staff, nearly half of whom are frontline workers who can particularly benefit from career progression and skills training. Next slide, please. So we do have about 600 of our frontline workers who are personal care assistants, or PCAs, and they do help with the basic types of functions that are needed for our most vulnerable population. And of note, many of our frontline workers have come to HSL with little prior work experience, and in some cases they're juggling additional jobs outside of HSL. Many are single parents, or they might be supporting multiple generations, and they may face additional economic and cultural barriers to traditional education programs. Next slide, please. So we do have a multifaceted strategy over the years for supporting frontline workers, and I'll be talking a little bit more in detail about the advanced leadership in geriatric care on the coming slides. But certainly we work with JVS of Boston for career counseling, transitions to work, and a multitude of other programs that they assist us with, and I'll give a little more detail about them as well. Then we have our professional development department, and we offer a whole array of educational programs across the whole system, and we also have the career development program housed within our department. And we also have a very active process improvement department, and I'll be telling you a little bit more about them as well. Next slide, please. Some of the other programs that are running within HSL would be our volunteer programs. So we have strong connections to the community. We have over 170 senior citizens from the community assisting us with various opportunities. We have youth and young and adults. We have multi-generational programming. type of academic programs focused on co-learning with older adults. And then we have college student rotations with preceptorships and so on. Next slide, please.
Mary, can you speak up a little bit? Thanks.
Oh, sure. So we do have lots of scholarship programs for nursing students. And as you can see from the slide, we have the Rose Career Development Program started in 2006. And right now we have 17 employees who are receiving nursing scholarships at this time. We've also had an online RN to BSN program affiliated with UMass Boston, and we had 14 graduates from that program. And you can see the LPN RN bridge as well, 5 graduates. And we had a very large number of people graduate from the LPN program, the Mass Bay Community College program. That was 48 graduates. And that was really involving some of our aides becoming LPNs. Next slide, please. In addition to the nursing scholarships, we also have scholarships that are issued by the Human Resources Department here. And there's a total of 47 total scholarships awarded in 2016. And you can see from the slide supporting employees and family members in a variety of endeavors. Next slide, please. So on this slide, we have an outline of the content that was delivered to CNAs who enrolled in a program called Advanced Leadership in Geriatric Care. This is a program that's been ongoing since 2012. We've had 44 graduates from this program, and it was originally funded by the Boston Foundation and is now sustained internally. Applicants need to be certified nurse assistants, and they need to meet a variety of criteria for admission to the program. And once enrolled, they go through approximately a semester's worth of classes in the content that you see there. So it's very, very rich with content and support and learning. And in addition, there's also 10 weeks of computer classes where the CNAs then learn all about Microsoft Office and Outlook and Meditech, which they use on a daily basis, but again, it's a review and thinking about getting people to a higher level of looking at that system. And then the CNAs learn to communicate with their colleagues via email and produce flyers for posting when they're working on projects. Next slide, please. You can see a picture there of one of our senior PCAs, Prince. And this slide tells you about the wage progression that was permitted to be put into action here. So all of the senior PCAs, upon graduation, receive $1 more an hour after successfully completing the program. Next slide, please. And of course, I would be remiss if I did not mention a very exciting graduation ceremony that is given at the end of each of these sessions. And so that's planned every single time, and it's to great acclaim. And the people who are graduating invite their family members and their significant others. We have top leadership attending and colleagues, and it's a wonderful party, a wonderful celebration. The members who are graduating make speeches about what they've learned, and so it's just heartwarming. So I wanted to mention that as well. We also have process improvement projects that are started by the senior PCAs once they graduate, once they get out to their unit. And you can see a brief listing of some of the projects there. I wanted to also explain that after graduation, the senior PCAs return to their units in a new leadership role. And they're a leader among their peers and their coworkers. And the manager is really instrumental in helping the senior PCA become adjusted to this new role. The manager runs regular meetings with the senior PCAs, during which coaching and mentoring are provided, along with discussions of problem solving and leadership opportunities. In addition, it's very important that emotional support is provided to these senior PCAs during a time of potentially stressful role adjustment. To give an example, many of the senior PCAs have transitioned relatively smoothly to their new roles on their floors. However, once in a while, the senior PCA will experience a comment from a coworker such as, quote, "You are not the boss of me," end quote. So the training provided in the coursework prepares the senior RAs for how to handle this type of experience, and also the manager provides the meeting times and the overall leadership and structure to support the whole team. and ultimately guides the staff towards appropriate integration of the senior PCA's new role into the team as a whole. And then I wanted to mention, in addition to process improvement, these wonderful leadership senior PCAs are taking on other roles as well, and we do have two of them currently they're certified to teach in our dementia training course, which is a required course for our rehab unit. It's an 8-hour course. Next slide, please. So the organizational impact is substantial, as you can see from this slide. Certainly Boston Globe's Best Places to Work 2015, 2016, and there's been a number of awards handed out to people who are part of the senior PCA group, and employee engagement is up, turnover rate is down, patient satisfaction is up. And as I mentioned, the senior PCAs are providing leadership and problem solving on their floors. Their peers come to them with problems that surface in everyday complex work of patient care. Some of the problems have been addressed through the development of process improvement projects with the assistance of our process improvement department. And one memorable example is the wheelchair project, which involved the labeling of individual wheelchairs and their parts, such as footrests, so that the parts could be more easily located when needed, thus reducing the risk of lost or misplaced items that are needed for patient safety. The senior PCA who developed this project, actually it was Prince, who was on a previous slide, he ultimately presented the overview of this project to the HSL leadership in several venues as an example of unit-based process improvement by frontline workers. Next slide, please. So again, I will talk here also about partnerships, very important partnerships here at HSL, and we have partnered with Jewish Vocational Services on a number of projects and also on the Senior PCA project. And so there's been absolutely essential support, as you can see on this slide, regarding the computer classes, Microsoft Office certificate program. The list really goes on, academic assistance, citizenship assistance, and so on. And I wanted to say, too, one of the questions is always, how does an organization determine how to work with another organization? And certainly there was a need here over the years as different career development programs were being developed, a need to look at a needs assessment. And the leadership here realized that they needed the type of organizational help from JVS. And there were leadership people here who really knew the leadership people at JVS and knew all the capabilities, so that was really a pretty easy decision, as it turns out. And because JVS was so accommodating, we really have continued to partner with them in terms of delivering classwork and support to meet the evolving needs here. Next slide, please. And that should be the end. Thank you.
Mary, thank you for that. I'd just like to have you put your headphone closer when we respond to some questions so everybody can make sure they hear you. So I have a couple of questions that have come in, and again, I want to thank Joanne and Mary for taking the time to tell us a little bit about their backstory within their organizations. We know that these are programs and initiatives that are years in the making, and we also know that engagement of senior leadership is incredibly important for sustainability and growth of these programs. Healthcare is experiencing a lot of change, rapid growth, et cetera. So starting with you, Joanne, within your organization, who within your organization did you have to convince to implement your incumbent worker training program? And how did you go about securing their support?
So one nice thing was that the big champion of this program was the new SVP of Human Resources, who said, I'll come on board, but I want to start a workforce development program. So she did a lot of work to convene people and talk about why there was a need for such a program, and subsequently I was hired. So she did a lot of the kind of getting the higher level buy-in to bring me on board. But then once I came on board, we needed to kind of work with different departments and convince them to take the risk of working differently with us. So we went to departments that were feeling the pain in some areas where they just weren't finding the talent they needed, and we built some programs with them. And, you know, when you first do it, it takes a lot of trust to convince somebody to do things a little bit differently and hire people in a way they haven't hired people before. And another thing we've done to continue to get senior leadership buy-in is every year we have a graduation, and we invite VPs who those departments report up to, who we've done programs with, so the VPs understand how the work we're doing impacts their bottom line and supports their employees. And then one other thing I wanted to mention is we've actually changed, our whole leadership suite has changed, including our president and CEO. And every time somebody new comes in, I make sure I find the time to meet with them, talk with them about what we're doing, and also, have them attend some graduations and other things so they can understand what it is we're doing and how it adds value to the bottom line.
Thanks, Joanne. Mary, would you like to? I know you haven't been at Hebrew Senior Life too terribly long, but would you like to talk a little bit about how support was secured for the Advanced Geriatric Leadership Program, and how you've continued to support that beyond grant funding?
Oh, sure. Well, it was a very creative idea on the part of my boss, the VP for Patient Care Services and Chief Nursing Officer, Tammy Ritalik. And, of course, the idea does go way back prior to my arrival, probably prior to 2012. And the vision was to work with the frontline worker, the nurse aide, to say how can this role be enhanced, thus enhancing patient care. So it really was sort of a groundbreaking idea, I believe, and it's turned out to be very, very successful, very well supported. As I mentioned, these senior PCAs do receive $1 more an hour, so that's a budgetary commitment right there. But also the commitment shows itself on every level, really, in terms of our being able to continue to educate these folks in-house, with in-house support, but also the managers. The managers are running meetings, to work with these senior PCAs and to continue to enhance their knowledge and their experiences and their judgments and leadership skills. So it's really been a tremendous success.
And Mary, this program was really directed towards those individual, what you call career CNAs or career assistants, who weren't necessarily, like they may gain the confidence to move on towards an LPN program, but that wasn't the ultimate goal. It was really to give them, as you mentioned, to elevate the role of those who are really dedicated to being in that role. Is that correct?
That's absolutely correct. That's absolutely correct. And there's other efforts afoot here as well. There's been a culture change initiative ongoing for a number of years. We're shifting the language a little bit to patient-directed care, but the idea is the same. So there's a TEL committee where there's representatives, including the nurse aide group, but also nurses and several senior PCAs, and it's all about patient-directed care. And so when I think about the senior PCA program and elevating the work that they do and really placing such importance on their identification of problems and then problem solving, it just all fits together beautifully.
Great, thanks. And so I think for our audience, it's really important to recognize that going to a point where you are offering up solutions to problems that senior leaders have. In the case of HSL, it's around patient care. In the case of Beth Israel Deaconess, it was particular vacancies and the challenges of filling those spots. But it really is about addressing pain points that are keeping your senior leaders up at night. So let's move on to a couple of other questions. Of course, there's always the question about funding. And I think in both instances, you mentioned, Joanne and Mary, that you started with grant funding, but then you saw the success of the program and you brought it in-house. People are curious as to what does it take to bring it in-house? They'd like to have more details about how you're funding the programs. So, Joanne, could you start?
Sure, yeah. So when we initially started, we would think about, could we use money toward tuition reimbursement a little creatively, and the funds weren't huge at the time. But when we wanted to scale it up, we realized we needed to commit some more money. And getting that grant from the Boston Foundation helped us with an infusion of money, and we could make the case as to why this was important. And then I think it was also very clever when the Boston Foundation gave us that grant. we were one of the first employers who'd ever received a grant. Normally they give grants to nonprofits, but we were committing to continuing to fund this program for an additional 3 years. So this was a condition of the grant, and so we had, we kind of locked everybody in, and when we went for the grant saying, and we're going to have to continue to sustain this for another 3 years. So we helped people kind of plan for that. Nobody was surprised when we asked to move more money into the workforce development budget at the end of that 3 years. But by that time, a lot of impact had been made in very key programs, so they helped to understand it. I think we've kept our budget pretty consistent over time, and we might use it for different things, but we've tried to have a budget that is pretty predictable. So I think at the end of that one grant, there was sort of some money that we had to put forward, but it's remained pretty steady since, and we've gotten creative and figured out how to do things in a more cost-effective way.
Great. Mary, do you want to add to that?
Sure. I mean, what you're asking about is sustainability, and I guess I start with the mission, vision, and values and the cultural beliefs that we have here and the commitment to those thoughts that's very clear. But then, too, if you talk about the practicality of funding and then sort of proceeding on without the funding, and that went on, of course, prior to my arrival, but what I can see is a lot of work went into the development of the program, the development of the materials, the development of the content, the arrangement of how do we offer this, how often do we offer it, the vetting of candidates, the list goes on and on. So all of that sort of development piece was done with the help of the Boston Foundation. And now that all those pieces are well exercised and rehearsed, I think it's been easier just to take it in-house and continue the good work.
And you've clearly seen that you're also tracking the data to demonstrate that it's making impact on turnover as well. Did you ever calculate the savings as a result of reducing turnover?
Well, I don't have those figures in front of me. I probably have to defer to our Human Resources Department on that. But we do have data showing that our turnover is down to 9.7%, and so we've been told that's fairly impressive.
Yeah, sorry, I would agree.
Yeah.
Good. Well, thank you. I think that I would also just note that we see many organizations go through this cycle of grant funding and then operational funding. To become a champion organization, you have to have at least 50% of your programming supported in-house. But we also see organizations that once they have sustained the work, they then use grant money to go out and test innovative new ideas. And so that is this kind of cycle of sustainability, grant funding to test new ideas, bring it in-house. So it's never static in terms of the funding. So let's move on to another question. Specifically, folks are wondering about the tools that are used to assess staff. And so maybe, Joanne, you could talk a little bit about what that assessment process looks like and what tools you guys are using.
Sure. So I mentioned that Bunker Hill Community College gave us access to be a testing site. So initially, for a lot of programs that we were offering through them, like our nursing and surge tech program, we would use the AccuPlacer, which tests people's readiness for college. And so we would use that test a lot, and we still will use it every once in a while, depending on the program. And if it's a college program, we definitely will use that test. We initially used the AccuPlacer for our patient care technician test, and we found that was not a good fit because we were testing for much more high of a level than we needed, and a lot of people were leaving the test very upset because they thought they failed, but it just wasn't the right test. So we switched to the TABE, and we used that to test, I believe it's English, reading, and math. We also have developed some assessments around attention to detail, which is important in a lot of jobs. Interviewing itself is an assessment. How prepared does somebody come for an interview, and do they really understand the job? We ask people to shadow, and we see how they are during that shadow process. What else do we do? We do a few live things, like for our pharmacy technicians, there's a hand-eye coordination piece that is important in that job. So we do an assessment of people's hand-eye coordination and see if they can, draw water through a syringe to a certain level. We've developed some of our own math tests for some different programs and occupations. And another important thing is we ask for the current manager to give an evaluation of this candidate for a new job. So we get a sense of what their attendance is like, what their attitude at work is like, if they get along with coworkers and things like that, which is all very important when you're trying to decide whether to move somebody onto a new job.
Thanks. Mary, are you guys using any different tools?
Our story is similar, not the same, of course. We have a couple of tools that have been written in-house that are being used by human resources. So we have a tool for nurses who are being considered for new hire, and we have a tool for a test, if you will, for nurse aides as well. And then a similar process to Joanne's in terms of manager assessments. Those are key in terms of awarding scholarships, in terms of considering people for the senior PCA program, and so on. And then, of course, we have all of the wonderful help from Jewish Vocational Services, where we've had all kinds of assistance over time with many of the career ladder programs, all kinds of assistance and assessments and support for this group of staff.
So Kelly, could I just add?
Oh, yeah, go ahead, John.
Sorry. Initially we started our pipeline programs before the Employee Career Initiative. So if somebody wasn't ready for a program, we would say, hey, sorry, your math skills aren't quite there. You should go take this course over at this college. But then when we had the Employee Career Initiative, it was a different conversation. And we could say, hey, your math skills aren't where they need to be for this program, but we're offering this math class on site in a month, and you can take that, and then the next time this opportunity comes around, you'll be able to take advantage of it. So it's not just a sort of testing and you're out, but testing, and let's see where you need to grow, and let's make a plan for you to grow.
Great. And I hear that assessments are customized depending on what the occupation is that you're looking to fill, and so I think that's an interesting of note. So yeah. I've got a specific question with relation to LPN certification training. And I think there's curiosity around that bridge between being an LPN and then earning the RN degree. And I'm wondering if, particularly at the associate's level, and we know that in a competitive market like Boston and with magnet status, that there is a real push to ensure that you are progressing towards the majority of your nursing staff having baccalaureate degrees. But could you talk just a little bit about what that pathway looks like for internal employees, and whether there's a guarantee of jobs at the end of that process as well? Joanne, I guess that's directed towards you.
Oh, okay. I wasn't sure if it was directed at me. I would say we don't see people going from LPN to ADN to BSN here. When we ran a nursing program, we did run an associate degree nursing program, and that was at the height of the nursing shortage, where we had 15% vacancy rates in nursing. Since that shortage has mellowed a little bit, the organization has made a decision to move to a Bachelor of Nursing as kind of the standard for hire. So we do have some nurses who had been hired previously who have an associate degree, and they are treated the same and compensated the same as the bachelor's folks, but they are encouraged to get a BSN. And so UMass Boston has a great online program, and we would actively sort of every year kind of promote this program for our employees and encourage them to use tuition reimbursement to get their BSN. But we currently, our status is that people need to have a BSN to come into this organization.
Okay. What about you, Mary? How do you support your LPNs who want to advance to become nurses?
Oh, sure.
So registered nurses.
We have a robust nursing scholarship program, which is housed in my department, professional development, and we have 17 recipients of nursing scholarship awards that those decisions were just made a couple of months ago. So they're for the academic year 2017-2018, but also extending, of course, because many programs, depending on which one they've chosen, could be multi-year, so we plan ahead for that. But definitely we're supporting people in their efforts to advance themselves, and we have people studying at many, many levels. So we've had CNAs who are interested in becoming an LPN. We've also had CNAs interested in going straight for the BSN. We have others going from CNA to rotation. So we have LPNs becoming RNs and so on. We have RNs becoming NPs, and they're supported also by our scholarship program. So we're supporting people at many different levels, and of course LPNs are hired here alongside of RNs, so it's a different situation from the medical centers in that regard.
Do you guarantee jobs at the end when people are finished?
So the people who are receiving the scholarships are already their employees, but to your point, I don't know that it's written as such as a guarantee, but we certainly have retained people as far as I know. In other words, every effort is made to say...
Yeah, right. Considering the investment that you've made in those workers, I would imagine that every effort will be made.
So we've just had a few folks in our September orientation who were doing exactly that, advancing into the next level, having graduated from their program.
Great. So, Michaela, could you take us to the next slide? I know we're getting close to the end here, but we did want to just point specifically to the way in which we see champion organizations leveraging these partnerships. And this is just a quote from our guide in that we have employers saying that they recognize that they do not need to develop and maintain expertise in all aspects of workforce development, and that it's really an effective use of their resources to draw on the strength of partner organizations. Next slide, please. And so I did want to just get your thoughts, Joanne and Mary, about what do you feel is kind of the criteria that you are looking for or that you use to select partners. And I offer up here what we call a partnering continuum, because I think there's recognition that there's varying levels of partnership, and that you could start off just networking with another organization to see if if there's ways to share information, that you could move towards coordinating your programs, and then full collaborating means that you're sharing resources, you're developing programs together, et cetera. So we know that there's that organizations fall within this continuum. But maybe you could both speak to what do you feel is the most important criteria for you to use when you are considering developing a new partnership? And Mary, you want to start?
Oh, sure. Well, I have to say that our answer here is Jewish Vocational Services. There's such a long history and a strong relationship. HSL has been working with JVS since, I think, 2007, and on a multitude of projects, and they've all been wonderful collaborations. So that's our answer here. We typically go with JVS.
And so relationship, it's really based on that long-standing relationship that you've had over time.
Exactly.
Okay. Joanne, what about you?
So I think the number one thing for us is quality. So if we're looking to partner with somebody for a nursing program, for example, we want to see if their graduates are passing the NCLEX. Or if we're looking to partner with somebody on a language program, we want to see how they're measuring success for their employees. And in fact, we were running our ESOL program with a different community-based provider who could never answer my question as to how do we know that people are actually learning and gaining from spending the time here. And I remember just having a meeting with JVS, and I asked the same question, and they said, well, there are these levels of English language proficiency, and with this number of hours of course, you should be moving up a level. And I was like, great. So we had a shared vision of sort of measurable goals that we're working toward to spend our money well, but also spend our employees' time well. So I think that's really important. Also, I like a partner that's kind of flexible, that's willing to do things a little bit differently, like Bunker Hill has been, and that's open to feedback when things aren't working, so you can both figure out how to make things work better.
Great. So I hear that your shared vision, the commitment to outcomes really driving a lot of your decision-making around partnerships. And then what we don't have on here is flexibility, but maybe it's the level of change that's required on both organizations' part. Joanne, can you just close us out here on talking about your philosophy around the role that employers play when they are developing a workforce development relationship with other organizations?
Yeah, so I have a very specific philosophy where I feel like it's not enough to just want to do a program. I feel like an employer needs, the more invested an employer is and the more they really understand all the elements of the program, the better that program is going to be, because Only the employer can really understand what the criteria are, can work with hiring managers, can reach the employees in the way you need to reach. So I think it's great to have a partner, but you don't want to be too passive in that partnership, and you really need to kind of manage what's happening and be like the project manager and use that partner and their resources to get to a result, but certainly kind of taking a strong hand in project managing.
Great, thank you. Well, so we have reached the 3 o'clock hour, and I know there's a couple of questions that we haven't been able to answer, so we will get back to you on that. But I do want to thank Joanne and Mary for taking the time today to join us and tell us a little bit about how they are supporting their incumbent workers and using partnerships to do that. Michaela, if you could just take us to the last slide. I'd like to welcome everybody to sign up for the third and fourth webinars that we have in our series. The next one on November 15th is really looking at how organizations are investing in their backyard, strategies to hire, retain, and advance local community members. This is looking at the anchor institution strategy. CareerStat is working closely with the Democracy Collaborative because they are really pushing the anchor institution strategy. And so we will be featuring a couple of organizations who are doing this work. And then finally on Wednesday, December 13th, if you could just go back, we are going to be talking to a couple of organizations that are really figuring out how to make learning and advancement accessible in the workplace. So they'll be highlighting work-based learning programs and HR practices that they find best support frontline workers who are interested in both keeping their jobs and advancing in their jobs. So please join us. You can go to the CareerStat website, and following this webinar, you will be getting an announcement for this. So again, thanks for the time. Enjoy the rest of your afternoon. Please feel free to reach out to myself at kaiken@nationalfund.org. I'd be happy to answer any of your questions. Have a great day. Thank you.